So when I see patients, a lot of the first patients, okay. Hi, this is Dr. Francisco Jacobe. I'm a general bariatric surgeon for Leaf Health EMD. Our topic of today is constipation after bariatric surgery. When I see patients, especially in a new class, one of the questions that I get from patients is whether they are going to develop diarrhea, especially after a gastric bypass. The important thing to understand is that diarrhea is extremely uncommon. One of the things that can commonly happen after bariatric surgery is constipation. It can happen with the sleep, it can happen with the gastric bypass. Constipation is related to the liquid intake, and in some patients it's related to the actual change in the function of the intestine. So it's very important to understand your bowel habits prior to surgery as well as compared to the bowel habits after surgery. You also got to take into account that the amount of food that you're eating is a lot less than what it was before, so the amount of bowel movement that you're going to have is also less. What to do if you are developing constipation? The number one thing is to check the amount of water that you're actually drinking. A lot of the times we think that we're drinking a lot more water than what we are. So it's very important to measure it, to make sure you have at least 64 ounces of liquid a day. The other thing is that once you're drinking enough water, if the constipation has not resolved, it's important to find a bowel regimen. What we recommend is for our patients to start taking milk and magnesia to make sure they have a bowel movement at least every other day. Severe constipation can be very troublesome, and some patients actually present to the emergency room related to abdominal pain because of constipation. Thank you for watching the video today. Please like us on Facebook, Instagram, and Twitter. Thank you so much. Share our video and subscribe too.